Hey, I want to stay with this slide that we were just talking about in the last lecture because I think it's really important to look at some of these cultural differences in self-efficacy, or sort of how their cultural context has an impact on self-efficacy. Particularly that, again, when comparing men and women with regard to self-efficacy, men tend to have higher self-efficacy in the math and sciences, while women have higher self-efficacy in the language arts. And also, what I find really interesting is that when you look at self-efficacy for science in general, vicarious learning is really important to the self-efficacy of a female student. So seeing someone who is essentially female persistent in doing well at the task increases the self-efficacy for females, while for males, mastery experiences really are important for self-efficacy. Also, interestingly, that American participants really look at self-efficacy, or they sort of express high self-efficacy even sometimes during poor performances. And sometimes Japanese and Korean students can actually have low efficacy even when they have high performance. So sometimes you can really see that these perceptions of your ability don't always match on objectively with your actual ability. The last couple of things we're going to talk about are Seligman's learned optimism versus dispositional optimism, and hope. Hope actually comes up a little bit more in other chapters, so we'll focus on it there. Learned helplessness is actually a model that was developed in the 60s by Seligman. Basically, that when rats learn different types of when they learned that their behavioral responses and the outcomes were really independent, basically no matter what they did, they got shocked. They became very passive. They didn't even try and avoid the shocks, even when it was really, really easy. And what Seligman found to be very interesting is that these individual differences didn't really explain individual differences in people. And so what he found is that they're optimists. We'll talk a little bit about this later, but what's really important in looking at learned optimism is that optimism and pessimism are really habits of thinking. If you want to know the difference between an optimist and a pessimist, at least when you're thinking about learned optimism, you can basically understand that difference in their explanatory style, the way that they describe how good or bad events were caused, or really their way they attributed the causes of good or different types of bad events. So let's just do this really quickly. Imagine you do some work that's highly praised at your job. What I want you to do is I want you to write down, what do you think would cause this? So, you've done something, someone comes and praises your work. What do you think would cause this? So take about a minute to write that down. Now what I want you to do is I want you to read what you wrote and try and rate how much these different types of causes are responsible for a person praising your work. How much are you responsible for causing that situation? 1, not at all. 7, totally. Do you think that whatever caused you to do good work in the present will also be there in the future? And do you think this cause really has other types of impacts on your life? What you find is that learned optimism, it basically says that the way that we explain how both good and bad events occur in ours can be explained across 3 different dimensions. How much we explain those events being internal to who we are or external to different types of events. How much the causes of the good or bad events are stable versus how much they're actually variable, and how much those causes have these global sort of catastrophic, if it's negative, impact on our lives, versus how much these types of events are very specific to the particular type of event that we're trying to explain. And at the core of pessimism, what you really see, going all the way back to a full loop to the 60s, is this feeling of learned helplessness, that no matter what you do, nothing's going to make a difference in the outcome. And pessimists really have this habit of thinking about bad events that are exceedingly eternal, stable, and global. So they tend to blame themselves. They believe that the events that caused this situation will last for a long time. They're going to be very stable, and that the consequences of these events will really undermine all the different types of things that they do. So, they might say that something like, I'm a loser, I always do really bad at tests, and these sort of internal, stable, global internal and stable events are going to have really negative consequences on a person's academic ability. Optimists are essentially the exact opposite in the way that they explain different types of events. So optimists see circumstances or other people as really being responsible for the bad events. They really externalize as opposed to internalize what would cause the bad events. They really see this defeat as very, very temporary. I did bad on one test, but I might not do bad on any test in the future. And again, it's very specific to this area of life. So I might have done really poorly in one area, but I'm doing really well in other areas of my life. Now, one thing that I don't really believe the book nor Seligman talks a lot about, but the last time I taught this class we ended up talking a lot about this, is we really need to be sure that we don't habitually externalize bad events. We don't always want to be blaming other people and other circumstances for essentially bad events in our life. It really can erode our responsibility. And I don't just mean this from sort of a sort of an American standpoint, because one of the more interesting things that we see cross-culturally is that pessimism can sometimes be really appropriate. For example, in Asian Americans, higher pessimism is really associated with greater problem solving. And so I think that this is actually a slightly different way of thinking about learned optimism. It's actually looking at mastery-oriented versus learned helplessness in academic abilities. But if you can see on the screen right here these attributions for these different types of outcomes, one of the important types of attributions is that the failure was really due to low effort versus the failure is really due to low ability. And so I think one of the things that we want to do is make sure that we don't think that these habits of thinking are really written in stone, but we also don't want to think of them as always externalizing, right? Okay, so what's really interesting is that there's actually no evidence that there's this genetic component for an explanatory style. And what does that mean? That means you can really change the way that you think, and you can really change if you want to be optimistic by just learning to argue with yourself, dispute your interpretations of different types of events that have actually occurred. And this is really different. Learned optimism, this sort of ability to sort of argue with yourself about how events occurred, is very different than dispositional optimism, which was by Carver and Shire, which really looks at optimism as a personality trait, having a relatively strong genetic component, sort of this characterized global expectation that good or bad things will happen to a person. And what they basically see is that optimists will basically continue to engage in certain types of behaviors because they have favorable expectations for their behaviors causing good change in the future, whereas pessimists tend to withdraw from effort because they have unfavorable expectations for anything ever changing. What's really interesting is that it's because these optimists report this more active, problem-focused coping style that their coping with stressors actually has an impact on the behaviors that they have. So optimistic heart patients actually exercise more, and not too surprisingly, they have better health outcomes. Optimistic individuals in really diverse settings actually engage in health-promoting behaviors more than pessimists. And of course, if you engage in the health-promoting behavior, then it's not too surprising that often you have the type of outcome that you're looking for in the health field. Okay, we're going to end with just looking really quickly at hope. I think that there's one really important part of hope. It can seem like this strange, nebulous type of construct, but let's just ask it as this way. What do you do when you're faced with an obstacle? So you've got a goal, you have basically something you're trying to approach, and then there's some sort of barrier that blocks your path. A person that has high hope will find a different way to achieve their goals. And one of the reasons that they'll try and find a different way to achieve their goals is because their agency, really, their belief in themselves is that they can actually institute change to accomplish these different types of goals. Now, people with high hope, they have all kinds of really, really positive outcomes, right? So they have higher academic performance, they do better in athletics, they cope better with pain tolerance and with different types of health issues. And so what you can really see is that one of the best ways to sort of think about hope is, are you using sort of pathway thinking, right? Are you really trying to come up with a new way to accomplish your goals in situations where there's some sort of barrier. So if you wanted to think what hope is, think of it as a function of agency, the belief in yourself, and coming up with multiple pathways to accomplish your goals.